So we'll be looking at the roles of eicosanoids in pathophysiological processes of the body. All right. We described eicosanoids earlier on. We said that they are basically chemical substances that mediate inflammation, they mediate immunity, and several other things. All right. So we'll be looking at the roles of this. We'll be looking at the roles of these eicosanoids. Okay, on different processes of the body. Okay, so moving now, the question is discussed with suitable examples the roles of eicosanoids in pathophysiological processes in the body. All right, and that's what we'll be doing. Okay, we're looking at the importance of these eicosanoids. So examples of these eicosanoids include prostaglandins, prostacyclins, thromboxane, leukotrienes, and the rest. Okay, we have already spoken about the various drugs that will basically inhibit these eicosanoids at different uh, levels of this pathway. Okay, that's eicosanoid inhibitors or eicosanoid blockers. We've already made a video on that. Okay, so let's talk about this effects of these eicosanoids and on various pathophysiological processes. Eicosanoids are formed by almost every cell in the body. Now, it is suspected that each pharmacological effect may reflect a physiological or pathophysiological function in the body. Okay. Now, these eicosanoids have an effect on platelets. Okay. Now, we said that it is okay. So their effect on platelets is like this. There will be release of arachidonic acid. You see this arachidonic acid, all right? And this arachidonic acid will be transformed to prostaglandin or prostaglandin H2 or thromboxane at the site of injury. Okay, so you can see, do I have this illustrated here? Well, these are the prostaglandins. Yeah, these are the thromboxanes, all right? It's just the prostaglandin H2 that is not indicated here, all right? So arachidonic could be converted into this at the site of injury, and these substances will induce platelet what aggregation. Now, prostaglandin I2 is a physiological antagonist of the system. Also, this system is antagonized by what? Aspirin-like. This system is antagonized by what? Aspirin-like drugs. That's if you want to actually inhibit this system. Okay. Then moving forward, I'm talking about the effects of these eicosanoids on reproduction and parturition. We said that it is suspected that prostaglandin deposited by the male during coitus may facilitate conception by acting on the cervix, uterus body, and the fallopian tube, and it also what affect the transportation of sperm. Okay, the prostaglandin from males. Okay, then also the contraction of all right, concentration, right, not contraction. The concentration of prostaglandin in blood and amniotic fluids are elevated during labor, okay, and they are involved in both the initiation of onset of labor and they serve to what sustain uterine contraction during labor, okay. So prostaglandins are also involved in contraction of the uterus during menstruation, okay. Prostaglandins are also involved in the contraction of what uterus during menstruation, okay. We have the vascular smooth muscles, effect on vascular smooth muscles. Prostaglandin E2 and prostaglandin I2 modulate vascular tone by counteracting the effect of what? Circulating vasoconstrictor autocoils by maintaining blood flow to the vital organs. Okay, so they will counteract the effect of what? Circulating vasoconstrictors. So therefore, they will lead to what? Vasodilation. Do you understand? So they are also implicated in the maintenance of potency of ductus arteriosus. Okay, they are involved in the maintenance of what? Placenta blood flow. Okay, so basically they help to like relax tissues, all right, and that will aid in blood. So you can see this picture. You can see prostaglandins in labor and delivery. Okay, then there are effects on inflammation and immune response. That's where you have prostanoids and leukotrienes are released by mechanical, thermal, chemical, bacteria, or and other insults, okay? And they may contribute to what genesis of signs and symptoms of inflammation, and they are also involved in what allergic reactions. All right. So the fifth one now, we have various leukotrienes and prostaglandins are released when synthesizing lung tissue. Okay, when synthesizing lung tissues are challenged by antigens and they play a role in bronchial hyperreactivity or asthma. All right, so definitely, basically, if you have like a foreign stuff in your lungs, all right, for the lungs to actually react to this, all right, is through the aid of what? These eicosanoids, all right, and basically the type of eicosanoids that mediate this is the leukotrienes and the prostaglandins. All right, so on the sixth effect now, we see that prostaglandin E3 is implicated in the production of what? Fever. Okay. Prostaglandin E2, E3 is implicated in the production of what? Fever. Right. So that's it about the different roles of what eicosanoids in the pathophysiology processes of the body. Okay.